The movie begins in the middle of the night, where two men visit the FBI office in San Francisco. A security guard stops them and asks for identification, but one of the men shows his badge, indicating that they are local police officers, Frank Connor and Matthew James. Because of this, the two are allowed to enter, but it seems they didn't visit for an official purpose. Instead, they head to a room designated only for authorized personnel. Matthew immediately sets up his laptop and begins hacking into the FBI system. They are looking for a person with a specific bone marrow for an unknown reason. Their work is interrupted when a guard passes by to do his duty, but Frank approaches him from behind, points a gun at him, and handcuffs him. After several minutes of searching, they finally find a man named Peter McCabe. However, Peter turns out to be a criminal with charges of murder, manslaughter, and assault. The next day, Officer Frank talks to his captain, where he learns that the criminal is currently in solitary confinement for breaking a prisoner's leg. Although Peter has no formal education, his IQ is over 150. Furthermore, he has escaped twice and killed 2 police officers in the process. On the second occasion, he burned them alive and used their IDs to confuse the police. Peter McCabe is not just a fugitive. He is an incredibly intelligent sociopath who loves to play with people's minds. Despite all the security risks, the captain agrees to let Frank meet with the criminal. Later, Frank goes straight to the interrogation room, where Peter is tied to a chair. This is when Frank's true motive of visiting the criminal is revealed. His 8-year-old son has leukemia. The boy desperately needs a bone marrow transplant to save his life. After appealing for donors on television for the past 6 months, Frank decides to take the search into his own hands. They broke into the FBI office the night before to look through the criminal database, and the only person who matches the requirements for the transplant is Peter. The criminal has no intention of helping. He messes with Frank and makes him beg before saying he will think about it. The desperate father begs Peter, even telling him that helping the child would be his redemption for his crimes. However, it is clear that a criminal like him doesn't seek redemption. Instead, he wants satisfaction and freedom. Later, Frank leaves the prison and goes straight to the hospital to see his son, Matt. There, he receives even worse news when the doctor tells him that Matt only has a few weeks left to live without a bone marrow transplant. The doctor asks Frank to prepare for the worst, but he refuses to listen. It turns out that Matt doesn't know that his cancer is back. He is excited about a new aviation book that his father gifted him and has no worries about the world. However, upon sensing his father's worry, the kid figures out something is wrong and inquires if he is going to die. Frank tells him about the cancer resurfacing, but lies that he has found a donor willing to participate. The boy is happy to hear the news, but he gives his father a heartfelt message, knowing that even if the operation is unsuccessful, his father did everything he could to help. At that moment, Frank receives a call from the prison because Peter has agreed to the transplant but wants to meet Matt first before confirming it. The officer is a little skeptical, but he promises to bring the kid the next day. The following day, Peter and Matt are in the interrogation room, where Peter asks the boy to call him Uncle Pete, and they have a brief conversation. There is nothing malicious in the conversation, and Peter even promises to be the kid's donor. But when Matt runs to his father in excitement, the criminal comes up with a bunch of demands. He wants to get out of solitary confinement and be able to socialize with other inmates. He also wants his smoking privileges back, and he should be allowed to use the computer in the prison library. The warden is not cooperative enough to grant such demands at first, but after Frank pulls some strings, he eventually agrees. Shortly after, Peter is given a cigarette, which prompts him to sign the consent form. The cops then leave him alone, and Peter begins the first step of his master escape plan. He ties his shoelace to his thumb and dislocates it. Meanwhile, Matt worries about receiving bone marrow from a criminal. But his father insists that receiving blood from an older person won't make him age, and that Peter's crimes have nothing to do with his body. At the prison, the mad criminal continues his preparations and approaches a secret drug supplier. The man doesn't want to negotiate with him, but Peter threatens him, saying he needs an ampule of a drug called Narcan, which is used to treat overdose victims. The supplier asks what he plans to use it for, to which Peter replies that everyone will know in due time. As the supplier works on getting the Narcan, Peter goes to the library and uses the computer to study the hospital map where the transplant will take place. The brilliant criminal wants to plan his escape route from the hospital. When a guard checks what he's doing, Peter pretends to be playing chess, and because he is so skilled at it, the guard doesn't suspect anything. Meanwhile, the police force prepares the hospital for Peter's arrival, ensuring complete security. Several helicopters will fly overhead, and a military escort will accompany him to and from the hospital. The night before the big day, the supplier gives Peter his daily medications, but secretly slips him 2 vials, one containing Narcan. While alone in his cell, Peter ties the ampoule to a thread and the other end to his teeth. He then swallows the ampoule to pull it out when he needs it. The day of the transplant finally arrives, and Peter is taken to the hospital in a large security convoy. He is taken to the operating room in restraints, but they have to be removed when he is kept on the bed. However, the police still handcuff him to the bed so he can't escape. As the doctors prepare to sedate him and begin the transplant, Peter breaks the ampoule in his mouth and drinks it. This prevents him from passing out, even after the anesthetics, leaving the doctors bewildered. Before they can figure out his plan, Peter has already managed to escape the handcuffs, thanks to his dislocated thumb. He uses a gas pipe from within the operating room to attack the doctors and guards before finally running away. Frank, who has been watching the chaos from the upper floor, runs to the scene. He helps the burning doctors before turning his attention to the criminal. Peter slides into a laundry chute and puts on a doctor's coat to hide himself. Where does it go? Laundry, basement, how many of these people? I bet the bastard dislocated his thumb. Despite having a chain tying his legs together and a gunshot wound on his leg, the man is unfazed. He goes to a room and threatens a lab technician to cut off his handcuffs with a laser gun. After that, he heads to the emergency room to get a morphine shot for the pain, but Frank catches him in the act. At this intense moment, Peter holds a scalpel to the throat of Samantha, the doctor who is in charge of the transplant. He demands that Frank stop chasing him, but Frank refuses and tries to shoot him. However, Samantha reveals that if Peter dies, his bone marrow will be useless, which would mean Matt can't be saved. As Frank contemplates what to do, a policeman named Wilson appears from behind a curtain. He aims his gun at Peter, demanding that he release the doctor. In a panic-stricken moment, Frank gives his gun to Peter so he can defend himself. The act ensures his departure from the police force, but all he cares about is saving his son. Soon, they are caught in a shootout where Peter kills another police officer and severely injures Wilson before running away. When the captain and his team arrive, he scolds Frank for letting other people die for the sake of his son's life. This leads the captain to order Frank to be locked up while the situation with Peter isn't over. However, when they are outside the hospital, Peter pushes the police into several reporters and quickly escapes on a motorcycle. Meanwhile, inside, Matt starts bleeding from his nose, so Samantha goes to care for him. Also with them is Officer Matthew, who is currently speaking with Frank on the phone, but Peter attacks him and knocks him down. The criminal threatens Samantha to reveal where the cyclopropane is in the hospital. He also promises Matt that he will send her back as soon as she helps him find what he wants. Meanwhile, Frank forcefully enters the hospital and goes straight to his son to check if he is okay. He also helps Matthew and learns that the fugitive was talking about propane. This gives him an idea of where Peter might have gone, so he orders Matthew to stay with the boy while he leaves. Elsewhere, Peter makes Samantha put 2 tanks of propane into a bag and asks for directions to the electrical room. He is planning to blow up the place as a distraction to escape without getting caught. However, Samantha suddenly uses a tank to attack him and escape from the criminal. She encounters Frank in the hallway and tells him where Peter is. The desperate father begs her not to tell the police about Peter's whereabouts, as he will surely get killed. Samantha is a bit hesitant, but she eventually agrees and goes to tend to Matt. Meanwhile, Peter arrives at the electrical room and spreads propane throughout the room, but Frank catches him outside. He points a gun at him and threatens him, but Peter knows he has the upper hand because Frank can't kill him. Using a cigarette, the criminal blows up the electrical room, causing the entire hospital's electrical system to shut down, including the ventilators and lights. As a result, Matthew moves Matt to the old building of the hospital, which is joined through a bridge. While trying to follow them, Frank notices Peter heading toward the same building after spotting him crossing the bridge. After climbing the fence, he attempts to enter the door but is spotted by police lights, prompting them to start shooting. However, Frank saves him from another building by shooting out the lights the police are using to spot Peter. Shortly after, the SWAT team enters the old building, meaning it wouldn't take long before Peter was caught or killed. To gain leverage over the guards, he holds their team leader hostage. This allows him access to the control room, which he uses to put the entire hospital on lockdown by closing all the doors. Meanwhile, Samantha is told that the child desperately needs a doctor and that she needs to reach the old building as soon as possible. When Frank learns of this, he immediately acts, hiding Samantha from everyone and bringing her to the other building. This act of heroism gains him appreciation even from Peter, who is watching them on security cameras. After being led inside, Frank and Samantha go to see Matt, while Peter plays out the next part of his plan. He takes the hostages to the rooftop as a distraction for the police, knowing that this will give the captain and his team the chance to cross the bridge to reach the building. Unbeknownst to them, Peter had placed a propane tank near the bridge to kill them, but Frank discovers the plan and saves the captain and his team by detonating the tank before they reach the bridge. Now, the only people in the building are Peter, Frank, Matthew, Matt, and Samantha. The last three are inside a locked room, while the other two are outside. Peter approaches Frank and threatens to kill him, but Matt quickly opens the door to save his father. He takes the four of them hostage and prepares to carry out the final step of his escape. He takes the child as a hostage and heads for the morgue, which leads to the underground tunnel. This is Peter's original escape plan all along, as he has acquired a map of the tunnel from the internet. He then makes a hole in the wall and apologizes to the kid. He tells him that he would have helped if he were not in such a dire situation. After this, he leaves the kid there and runs through the tunnel. But it isn't long before Frank finds out about Peter's plan and sees him driving away in a blue car. To follow him, Frank steals a police car and uses the police ID to request help from the control room. After a few minutes of pursuing the fugitive, Frank finally sees him heading towards a bridge. This gives him an idea, and he contacts the bridge operator through the police car's intercom system. In the meantime, the news of the criminal trying to flee in a blue truck reaches the captain. He quickly gets into a search helicopter along with a police sniper. They are headed towards the same bridge where all the action is happening. On the other hand, Peter realizes he is being followed and accelerates his vehicle. But to his dismay, the operator has already locked all the exits. After a long chase, Frank finally corners the criminal on the bridge, but Peter still holds the gun he stole from a police officer. While aiming at Frank, the helicopter carrying the captain and a sniper suddenly arrives, and Peter uses this opportunity to create chaos by shooting at the helicopter. The sniper returns fire, but Frank jumps in front of Peter and takes the bullet in the arm to save him. This gives Peter another chance to escape, and he tries to jump off the bridge, but Frank shoots his leg, causing him to fall into the river. With his remaining strength, the officer then jumps into the water and saves Peter just in time. After all of this, an injured Peter is transported back to the hospital. He knows that he may very well succumb to his injuries and finally agrees to the transplant. At the hospital, Samantha heads the complex surgery. They take up unnecessary stem cells from Peter's spinal cord and transplant them to Matt. Fortunately, the whole operation is a success, and the little boy gets his life back. On the other hand, Peter has a more difficult road to recovery. He is kept inside a glass box in the hospital, which is guarded by a police officer around the clock. One day, after a routine checkup, Peter calls in the officer. The criminal seems to be struggling and can barely talk. He gestures at the officer to lean in close and asks how Matt is doing. The officer informs him that Matt is doing fine, but at that moment, Peter steals the officer's gun. The movie ends as he asks the cop what kind of a car he drives. Thank you so much for staying till the end. If you enjoyed this video, please consider leaving a like, and don't forget to subscribe and hit the notification bell for future uploads.